Hello everyone, I'm Deborah Garlick from Henpicked Menopause in the Workplace and author of the book Menopause, The Change for the Better. And thank you for joining us for this session today. And I've got to say, it's been massively popular. So clearly many of us struggling with bloating and other digestive issues during the menopause. So I'm delighted to welcome back with us Nigel Denby, from Harley Street at Health. I was Harley Street at Home. Nigel, I was just about to say, who we know for all of his practical advice and top tips and no messing around top tips at that. And I can read off everything that you've done here, Nigel. Nigel Denby is a registered dietitian, author of 10 successful nutrition books, broadcaster, supportive of the British Menopause Society. In fact, I know that you collaborate a lot and so much more. And the clinical areas including weight management, women's health and irritable bowel syndrome. And so, of course, you're very, very able to talk us through everything that's going on with bloating and other digestive issues during the menopause. And I've got to say, Nigel, when we first talked about this session, I was very much in the place of actually during my periods, I used to have terrible bloating at least once a month. But when we advertised this session and said that we were going to be talking about bloating and digestive issues, so much traffic coming in and so many people signing up for this session. So it clearly affects a lot of people. So welcome. I'm looking forward to hearing from you around actually what's going on.
Thank you, Deborah, and thanks so much for having me back. It's lovely to be with you again and to see so many people joining us. It's fantastic. And you're absolutely right. I think next to weight gain, there is I think bloating, digestive health issues in general are probably the second most common thing that we're asked about at Harley Street at Home. And I think people generally, and we'll probably do quite a lot of generalization, but obviously if people have got questions, we'll try and answer some of those as well. Women generally at perimenopause fall into two camps, I think. We've either got women who have struggled with IBS and digestive health issues all their lives, and they've kind of found their way of managing things by the time they get to perimenopause, and then everything changes. And the symptoms they're experiencing are quite different. Triggers that might have previously never been an issue for them now start to seem to bother them. And it can really almost overtake some of the menopause symptoms, the other menopause symptoms. Then we've got another group of women who have never had an issue with their digestion in their lives, and all of a sudden start to experiencing some of, but not necessarily all of, the following: bloating, abdominal pain, gas, a change in bowel habits, either becoming more sluggish and constipated, or becoming more loose, urgent, and sort of diarrhea-like, or drifting between the two. Urgency can become quite a large problem, particularly if there are issues around the pelvic floor health. And we can also start to see just a feeling of never quite finishing when you go to the loo. We call it, it's got a lovely name called incomplete evacuation, but it pretty much says what it is. You just are just never quite sure that you're done. In terms of the triggers, my goodness, there can be all sorts, and we'll come on to that. Now, what we're talking about, though, is very different from the sort of cyclical bloating that you might associate with PMS. And that tends to be a hormonal trigger for bloating, can often be quite a fluid related bloating. You can find you get a bit puffy and what have you. This tends, and the way easily to see really, is this more digestive or hormonal, is if your symptoms are with you most days, or 2 or 3 days of most weeks, then we're beginning to look at something that is much more digestive related than a hormone related issue. Just one other caveat to get in there as well is women who are taking HRT may find, if you've got your uterus and you're taking progesterone, particularly if you're still having periods and you're then taking your progesterone over a 14 or a 21-day cycle, you may find, if you take your progesterone orally, that makes you a little bit puffy and fluid retentive again. And again, that usually settles after 2 or 3 months of starting it. And that's different from the sort of digestive health bloating that we're talking about today. The bloating you and I are talking about is essentially, I'll stand up for this, when you get a buildup of gas, which you can get in your large intestine for multiple reasons that we'll go into, it causes your diaphragm to push down a little bit to protect the internal organs. That causes a bloat, and the bloat can be quite hard, like a football, despite the fact that it's predominantly gas that's causing it. And you can literally see your tummy almost expand, within minutes or hours. You can find you needing to literally undo your trousers, and that what was done up before starts to gape by easily that much. So this is really uncomfortable, nasty, and a bit unnerving, if you've got to stand up and start giving presentations at work, or going where you're going to be, you want to be on your top form. This can really throw you.
That's interesting then. So, the hormonal bloating that I would have got during my periods, which thank you, menopause, I don't get that anymore. But that one was always I used to feel everything was tight around my waist, and it was always, during a special occasion or something, I always used to think I'd look like I got a tongue, and it was like not okay. And I don't get that now, but every so often I do get some bloating, but it can be hormonal possibly then, and it can be more than that, the menopause transition actually affecting the digestive system, which I was quite horrified when you said that earlier, that it can have that sort of impact. Why is that happening? Why does menopause affect the digestion?
Well, it's a really interesting one, because I think, to be honest, we don't really understand it fully. What we know, and there's some theories, and I guess at this point, it's almost, we have to look at this in the same way that I might any patient I'm working with IBS, irritable bowel syndrome, or digestive health issues. It's rarely just one cause, Deborah, but we need to look at the whole shebang. So let's think, first of all, the mechanics of how your digestive system works. So predominantly, a lot of what we're going to be talking about is the large intestine. I'm up again. This is your colon, large intestine, colon, same thing. It rises up here on the right-hand side. That's your ascending colon. Then you've got your transverse colon just underneath your rib cage, and your descending colon on the left. So it's like an N shape. That's the end of digestion. And it tends to be the area of the digestive tract that has muscles that are circular like this. You get these in the esophagus as well. And if you imagine icing a cake or a snake's body that's just eaten a big old mouse, those muscles literally push material along. So in the esophagus, they're pushing food down your food pipe. In your colon, they're pushing waste along the colon. And when the muscles start going like this, contracting and relaxing, that's the sensation you get that you need a poo. We call it peristalsis, mass peristalsis. And generally speaking, you shouldn't really have any control over those muscles at all. That all works automatically with the brain. And really interesting, we've seen if somebody looks at the clock and notices, oh, it's getting up for lunchtime, that can set peristalsis off. Just knowing food is coming makes sense. Let's make some room. We're going to eat again. Or even if you walk into Sainsbury's or Tesco's and you smell fresh bread, that could send you off. Now, when those muscles, occasionally, if you're a bit of a stress head and you've got a lot of anxiety, a lot of those things going down, you can find those muscles lock and they can really cause a bit of a backup. That's constipation, sluggish bowel. Because that's waste material, you're going to get gas build up in there as long with that waste material. There's the bloat. Usually, remember old school biology, then osmosis lets water into that digestive system. Now think about it, we've got waste material, we've got gas, and we've got water. Any minute now, those muscles are going to relax and we've got urgency and diarrhea. So one often with people who are worriers, what you may well find is that you send your anxiety and your stress to your tummy in the same way that someone might grind their teeth and get headaches. So one thing we often look at is stress management, meditation, and also abdominal massage, lying flat on the bed at night and gently massaging the line of that colon for 5 or 10 minutes can be really useful. Other things, though, can be going on as well. If you are a lady who's had abdominal surgery, maybe you've had a C-section at some stage, that kind of trauma around your abdomen can really upset what we call the microbiome, the gut bacteria that lives in your gut, the friendly bacteria. Other things that might also upset that bacteria could be lots of use of antibiotics historically, 10, 20 years ago. A really poor diet, maybe when you were at uni, didn't eat so well. And also if you've had food poisoning, gastroenteritis, in other words, invasions of bad bacteria, all of those things can upset that microbiome. And occasionally it will mean that you then start struggling to digest a group of foods called FODMAPs, which is an abbreviation for fermentable types of carbohydrates, really healthy foods, but foods that require some fermentation in the gut. And suddenly those foods can start to become troublesome. Now, whether menopause is a trigger for any one of those things, we really don't know. It's just not been studied. But certainly, as a dietitian working in this field, and as working with thousands of women through Harley Street at home, we can't get away from the fact that this is real and it is impacting lots and lots of different women. And of course, women are feeling quite vulnerable and reaching out for anything that that they might think might help. Very often, remedies and products off the pharmacy shelf are a bit of a waste of time. So hopefully we can give some really practical tips on how to manage this.
But all you're saying makes perfect sense to me as well, because, through the menopause, and as you said earlier, somebody that's not struggled with this before or it could be the first time. It could be that somebody has had issues before and they get worse during the menopause. But then when you add to it anxiety on top of that, which is a common menopause symptom, and difficulty, all of those things, it's like the perfect storm. So even if it can't be proved, if the research hasn't there, logically it makes sense that actually if we're stressed out with anxiety, and you've got low mood and all of those sorts of things on top of digestive issues, it's all going to feel worse.
Of course it is.
And similarly, if you can do things, I liked the massaging your tummy, that makes perfect sense too. But also if you can relax a little bit more and say, actually, I understand what's going on in my body and etc., then that relaxing and hopefully the relaxing of muscles might help too.
Absolutely. And I think I've rarely seen any patient over all the years I've been working in this area where it is just one solution. Normally we look at all four of those areas and we start thinking about one of them potentially by really taking a detailed history and starting to understand, when did this really start? You know, what did happen? Did you go off traveling after uni? What about how were your children born? What about incidents of antibiotic use or infection? All of this sort of thing. And then we begin to say, right, I think this is probably the leader, if you like, for what's going on. But let's bring in a bit of relaxation, some mindfulness and meditation to go along with this. Let's have a look at maybe tweaking your diet a little bit. I mean, and it's changed enormously. I can see all these comments coming in. You know, when I trained, Deborah, 25 years ago, in those days, we used to be taught that for IBS, you either walloped people's fibre up or took it right down and gave them no fibre at all. And we were even taught the reality is probably neither of those things will work, and you're just going to have to leave people to get on with it. Thankfully, the way we can manage digestive health now has completely revolutionized. I reckon we can help 80 to 90% of people. And it's generally, again, just like you and I might get headaches if we worry a lot or under a lot of pressure or we don't drink enough water. Generally, it's something that you learn to manage and to just keep on top of. But knowing how to manage it is just liberating for someone. I mean, if you imagine you don't know if you're going out today, are you going to need the loo all day or not? Or are you going to be bloated and sore and worried about being gassy and smelly and all of that? Or can you go out knowing, right, I've done all my bits, everything's fine, I can get on with this day? That's a game changer if you can get to that bit.
It is, but you know, regardless of what the triggers are, then how might you manage this? If you're listening into this and you're thinking, well, that's me, I'm you know, either needing to go to the toilet urgently, or I've been constipated for days, or I don't know if today's the day I'm going to look 6 months pregnant by the end of it. Where do you start?
Well, first thing I normally suggest, and anyone who's ever heard me talking about anything to do with diet will always come back to, let's start with a diary. We really need to look at a symptom diary and a food and activity diary. We've got to look at the whole picture and start to see what the patterns are. Amazingly, sometimes that's enough to really start to see it. Then we need to think about your stresses and look at, is there any self-care in your day, in your week? Because again, we could talk about self-care with just about everything, couldn't we? It fits everything that's going on for you at this time. So again, not going to apologize for bringing that in. You might want to think about a good quality probiotic, and I've heard people mentioning, various ones on the chat there. Just a bit on probiotics. So probiotics are like they're in the same category as vitamin and mineral supplements. So as food supplements, they are less well regulated than the food that we would serve our dogs. So you've got to be really careful what you're buying. Probiotics give you good bacteria, but for lots of different reasons that we won't have time to go into today, you're not really meant to take your good bacteria orally to pass all the way through the acid environment of your tummy and get to the long tube of your digestive system and finally reach your large intestine intact. That was all sealed off when you were a baby. So you're not really meant to get your probiotics that way. So a lot of them don't even get past your stomach. They're digested in there and destroyed by the acid in your stomach. And again, because they're not well regulated, a lot of them don't bother doing any testing to see if that actually happens. So you'll not often hear me talk about brands, but there are 3 brands he says 4, 3 brands that I do recommend, only because I know they've done the science and they are good quality. So the first one is Optibac. That comes in a capsule. It's called Optibac Every Day. And if you're going to try any probiotics, I would do this for 3 months to really see the full potential benefit. The next one is called Simprove, and that's Symprove, and that's a water-based probiotic. Tastes a little bit sour. You keep it in the fridge, but it does exactly what it's meant to do. And the last one is called VSL, VSL number 3, and that comes in a sachet and it's a powder, and you can sprinkle that over food or dilute it in water. Those are the only 3 I really feel comfortable with in terms of their science. All of them very, very good quality. I will put those probiotics in the chat, Joanne.
Yes, and we'll add it to the article when we send that out as well, so we can add a link. So that's the supplements. What about food?
So
are there certain foods to avoid and ones that you should go for?
Well, if you wanted to, first of all, when I first look at a food diary, I do actually go back to the old school thing and think, okay, what level of fiber is there in there? Is this person using whole grains? Are they using wholemeal bread, brown pasta, brown rice? Is there lots of fruit and veg in there? If there isn't, you know, that's your basics. You've got to get that sort of thing in first of all. If, however, the diet looks pretty good, then we can start thinking about the potential of these FODMAPs. Now, that just stands for things like fructans, oligosaccharides, a whole load of sort of sciencey names. FODMAPs is easier. Pretty much the sorts of things you're talking about are, and I don't want people to think about these as good or bad. They're healthy foods. The only issue with them is some people will struggle if they don't ferment them as well as they should. So the first one is wheat. Then we have pulses, beans, and lentils. Then we have artificial sweeteners, lactose, the sugar found in milk, and then quite a big range of fruits and vegetables. Now you can look at these. Thank you, Sally, for those probiotics. You can look at these and think, gosh, these look like the Mediterranean diet. Isn't that really healthy? Yes, it is. Don't demonize these foods. This is a clinical trial. And what we would look at doing is an exclusion phase for about 3 to 4 weeks, where you take all of these foods out of your diet and then see if you feel better. That's resting the gut. You'd probably take your probiotics, you'd be doing your massage, you'd be doing your relaxation. So we give it the best chance ever to really take a break. And hopefully after 3-4 weeks, you say to me, Nigel, 5 days, I feel fab. No bloating, no problems. That's the end of that phase. We then go into the reintroduction of all of those foods in a very controlled, strategic way. So we start to see which one causes an issue and which one doesn't. The last phase, phase 3, and I'm sort of hammering home, this is 3 phases. I see a lot of people, Deborah, they read about the low FODMAP diet, they exclude all these foods, and then they get stuck at phase 1. So you've got to get to phase 3. Phase 3 is when you've done your reintroduction, you've maybe got a small pile of foods that gave you a reaction. They're foods you're probably going to avoid long term. Then we've got a big pile of foods that you reintroduced and didn't cause you an issue at all. Brilliant. But you've tried those foods in isolation. Now we need to try them like a real diet and mix them together and see what load you can deal with. And that's really when we build your long-term diet plan. So that's kind of the diet. Start with the basics. Are you eating lots of fruit and veg, lots of fiber, drinking lots of water? If you eat a lot of fiber and you don't drink enough water, you will get constipated and bloated. So you've got to increase your fluid with your fiber. That whole process can take about 3 months. But if you've been feeling lousy for quite a while, it's worth it.
It's worth it if it helps. And also, I'll ask my colleague Sally if she wants to join us for the Q&A, because I think the interesting one I saw there was, so what can you eat then? But it's about excluding it and then introducing things back in so that you understand what's giving you an issue. I mean, for me, that would absolutely be yogurt. I can't eat yogurt. It gives me terrible stomach ache. But yeah, I always used to be able to, but so now I know to avoid that.
Exactly.
But different people will have different responses to different things.
Very much so. And that's again what this whole process is about. It's about personalizing what you can and you can't eat. And of course, one of the things that happens when we get in a forum like this, and we're talking about it, and we're legitimizing and validating how people feel, because often we don't want to talk about going to the loo, do we? So it can feel a little bit, you can feel quite isolated when you've struggled with this. And then all of a sudden you hear, oh my God, it's real. And look, there's 557 people in here struggling with the same sorts of things. And then it gets into, well, I did this and I did that and I did whatever. Really try and avoid that. Stick with the science, and let's keep this really personalized to you, because it isn't a one size fits all. And what Mary up the road did is brilliant for Mary up the road, but it might not suit you.
Yeah.
Thank you very much, Nigel. Sally?
Yeah, absolutely. And we've got loads of people sharing and just being really supportive of each other, as always, on these calls. So really appreciate that. Someone asked around food allergy testing. What are your thoughts on that, and how can that be helpful, or is that something people should be looking at?
No. In short, I tell you why. So to measure a food allergy, you really need to go to a specialist allergy clinic where they will do a skin prick test and check you against lots of different potential allergens. There are masses of allergy tests available on the high street and online. The vast majority of them are utter garbage, a total waste of money. They won't give you any science, evidence-based information, and they will probably send you right down a rabbit hole. Often people will be drawn in also to intolerance testing. You can't test for an intolerance. You can test for an allergy, because you will see the response of an allergic reaction in the blood. When you have an intolerance, there's nothing to measure. The only thing you can do is the sort of exclusion that I've described, because there isn't anything to see other than your reactions. Now, of course, when it comes to FODMAPs, sometimes because these foods fall into different groups, sometimes you can sort of see a trace. Someone will say, I really can't deal with onion and garlic. I've seen that a couple of times in the chat. Now, there are other foods in that same group, that same family of FODMAPs. And often what I would be inclined to do is say, well, look, before we do the whole FODMAP diet, let's just take that family out and see how that feels for you. That can be a halfway house, but yeah, be careful of testing.
Brilliant, thank you. I think there's so many people, it is a real issue. You can see, someone saying they're terrified about what to eat and drink because they don't know how they're going to respond. People feeling really embarrassed about going out because they don't know what they're going to deal with. So I just think, firstly, appreciate everyone sharing and just reassuring people they're not on their own. This is real, as you say, and actually that acknowledgement and being able to talk about it's really important. People have talked about why so at the start of the day, they can feel, kind of, someone said I'm a size 8 at the start of the day, and then I feel like I'm 9 months pregnant by the end of the day. What's that going on, and what can people do to kind of manage that?
Sure, Sally, that's really popular, really common. What it tends to mean is, whilst you might not have a lot of the debilitating IBS type symptoms, this bloating has started to become an issue, and you probably are either a wee bit sensitive to some of the FODMAP foods, and you may well find that the bloating is a reaction to gradually taking in more FODMAPs as the day goes on. That can be a time when just even using a probiotic, using the relaxation techniques that we've talked about, the mindfulness, the meditation, and that abdominal massage can be so, so helpful. The massage, just on that note, what you're aiming to do is just manually force those muscles to relax a little bit. Generally through the night, although we don't lie there farting all night, what we do is built up gas through the night just gradually disperses. That's what you want to be able to do. And by doing that massage at bedtime, you should start to get that beginning to happen. It doesn't happen overnight. And again, you probably didn't start getting your symptoms overnight. So make a plan, I would say, and do all of the things. Think about the massage, the mindfulness, the meditation, maybe looking at your diet a little bit, a probiotic, and say this is going to be a 3-month project. It's not going to happen tomorrow, you know, but you're looking to see things gradually improve. I'm noticing loads of questions about fasting.
I know. Yeah. I've just pointed people at Harley Street at home because I get a timetable from you every week, Nigel. Just a couple of quick ones because we haven't run over, and I'm afraid you're going to have to come back now if you wouldn't mind.
Promise.
But one that was interesting was massaging after every meal and massaging in which direction?
I wouldn't massage after every meal. I do it at night time, and you're going from right to left. So ascending up and down. So you're going in that direction. Ladies, fasting, no. Please don't fast to try and sort out IBS and digestive health issues. It really won't help you. It's not that complex. We will definitely come back and do this again. Maybe I can also just mention in the autumn, we'll be running a digestive health course, a 6-week course that helps you explore a lot of this. And it's just part of your membership, ladies. So look out for that.
Thank you, Nigel. I'll ask you for some information. So when we send out the newsletter, people can find that, because honestly, it's great to have you here today and to hear so much, but my goodness, it was a popular session, but so many questions, and so lovely to see how supportive everyone is of everyone in this, because we're all in this together, aren't we?
100%.
Thank you very much, Nigel, and thank you very much, Sally, for managing the questions, and thank you very much for joining us. We look forward to seeing you again.
Lovely. Thanks for having me.